Hi everybody. Today I will be explaining to you about the clinical characteristics of schizophrenia, but first, what is mental health? Mental health is the psychological well-being point, or mental disorder absence. Mental health can include an individual's ability to enjoy life and to create a balance between life's activities and efforts to achieve psychological resilience. The study estimated that in 2017, 792 million people living with a mental health disorder. Worldwide, that's just over 1 in 10 people. Misconception or stigma of mental illness.
He's exaggerating. You're just an attention seeker.
Now, I don't think I could tell anybody. People often stop communicating to the world about their mental health due to the misconception of mental illness. What is the factors of schizophrenia? Biological factors. Drug and alcohol abuse, stress, traumatic events. Biological factors. Schizophrenia tends to run in the family, but no single gene is thought to be responsible. Different combination sets of gene can make people vulnerable to schizophrenia. Traumatic events. Children who had been abused are 3 times more likely to develop schizophrenia. Childhood trauma is explained as a severe form of stress that renders individual to affect the endocrine system and epigenetic mechanism which can cause schizophrenia. Stress. The stressful life events such as bereavement, divorce and losing a job can trigger the development of schizophrenia in a person. The stressful events do not directly link to schizophrenia, but induce symptoms especially for those who are vulnerable. Drug and alcohol abuse. Over half of those diagnosed with schizophrenia in the UK have an alcohol or drugs abuse along with other mental illness. Drugs does not directly cause schizophrenia, but studies have shown that drug misuse can increase the risk of developing schizophrenia. What is the types of schizophrenia? According to On Health, 2016, there are 5 types of schizophrenia whose classification had been used as a reference by experts first. They are paranoid schizophrenia, disorganized schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia and residual schizophrenia. The characteristic of schizophrenia. According to Clark 2019, there are some of the common characteristics of schizophrenia such as hallucinations, disorganized speech, disorganized behavior and delusions. Delusions are extremely common in schizophrenia, occurring in more than 90% of those who have the disorder. Several people create a delusional notion to justify why they are experiencing a hallucination. Hallucinations are where someone sees, hears, smells, tastes or feels things that do not exist outside their mind. Some people describe the voices they hear as friendly and pleasant, but more often they're rude, critical, abusive or annoying. Disorganized speech. Schizophrenia will cause the patient difficulty focusing and sustaining a line of thought, manifesting itself externally in the manner they speak. Disorganized behavior. Disorganized behavior occurs as a decrease in overall daily functioning, erratic or inappropriate emotional responses, actions that seem abnormal and have no meaning and loss of inhibition and impulse control. What is the treatments of schizophrenia? Schizophrenia is one of the most difficult diseases to treat. Taking a good treatment usually can help to reduce the symptoms of schizophrenia and it may require lifelong treatment, even though symptoms are decreasing. Majority people who have these problems must be specialized for a lifetime. Psychiatrists say the most effective treatment for schizophrenia patients is usually a combination of medication, psychosocial intervention and self-help resources. Medication. Medication plays an important role to help control the symptoms of schizophrenia. Antipsychotic medication is the most common treatment to treat schizophrenia disorder. Antipsychotic drugs work by affecting the neurotransmitter dopamine and serotonin in the brain. so these drugs can help relieve the symptoms of schizophrenia. Antipsychotic medications are usually in pill or liquid form and it must be taken daily. Some antipsychotics are injections and it is given once or twice in a month. Psychosocial intervention. Individual therapy. This therapy can help to normalize patients' thought patterns. Through this therapy, the patient will learn how to cope with their stress and identify early warning signs of relapse so that they can manage their illness. Social skills training. This training will help patients to improve their communication with people and improve their social skills to increase their ability to participate in daily activities. Family therapy. The love and support from family plays an important role in dealing with schizophrenia. Electroconvulsive therapy. This therapy is one of the fastest way to treat severely depressed, suicidal and other mental illnesses. In schizophrenia, electroconvulsive therapy is very effective for a syndrome called catatonia, which is a type of schizophrenia, some forms of depression, bipolar disorder, and other psychiatric disorders. This therapy can be used to ease schizophrenia's symptoms, such as delusions, hallucinations, or disorganized thinking. Electroconvulsive treatment is provided through very low volatility of electricity across a person's brain. Low voltage electricity is used to provide a shock to the brain system. Self-help. People who suffer from schizophrenia should help themselves by taking good care of themselves. One of the best ways to treat schizophrenia is to engage in treatments such as consulting a specialist and following all the advice provided. This people are also should learn about how to control their emotions and try to avoid stresses. They also need to practice a healthy lifestyle such as exercise, eating a balanced diet and getting enough sleep so that they can be healthier and calmer.